Hello everyone, I am Dr. Harini Sreedharan, consultant neonatologist and pediatrician at Mazumdar Shaw Medical Center, Narayana Health City, Bangalore. We all know the age-old saying that it takes an army to raise a child. As much as joy we have at the birth of a newborn, that much of stress also we do undergo as parents. So today I'm going to share a few parenting tips for a newborn child. The most important thing when it comes to a newborn child is feeding. And as we all know, breastfeeding is the best start for a newborn baby. Not only is it a source of hunger, but it's also a source of water and fluids for the baby. So it is very important that in addition to breast milk, we do not offer any other pre-lacteal feeds like water or diluted cow's milk to the baby. It is very important to check the adequacy of the breastfeeding by getting regular weight checkups done of the baby with the doctor as advised by your doctor. It is otherwise very difficult to say whether the breastfeeding is sufficient or not. There are a lot of other misconceptions that my breasts are empty or my child is crying. I'm not sure whether my milk is enough or not. Most of these misconceptions can be solved by a regular doctor visit, and the weight of the child is the most important indicator of the adequacy of breastfeeding. There is no particular schedule for feeding the baby. The baby needs to be fed on demand. And this feeding frequency and schedule can change multiple times during the initial few months. There is nothing fixed when it comes to breastfeeding. In case the baby requires any other form of feeding apart from breastfeeding, or there are difficulties, then please consult with your baby's doctor or pediatrician to know more about them. The other thing which constantly worries about the baby is that, is my baby getting sufficient sleep? Is my baby resting enough? We all know that sleep and rest is very essential for the development of the baby's brain. Again, when it comes to sleeping, there is no specific schedule for a baby. A generally healthy and a well-fed baby sleeps for approximately 18 to 20 hours a day. And majority of the times the baby sleeps also while feeding. Standalone periods of sleep are very few compared to sleeping while feeding. This sleep frequency and pattern also changes very frequently during the initial few months. In case your baby is excessively sleepy, very difficult to wake up, does not feed very well, does not complete the feed, or in case your baby is very irritable and crying throughout the day, then please do consult your baby's doctor or pediatrician. The other thing we worry about is when our newborn babies become sick. There are no specific signs of sickness in a newborn baby, and that makes it very difficult for us as parents to assess how sick our baby is. In case your baby has caught up with a seasonal cold, cough, fever, or loose stools, it is very important to contact your baby's doctor and pediatrician for the same. Self-medication can be very risky as a lot of medicines have unwanted side effects. So, in case of any doubt regarding sickness, please don't hesitate to visit your baby's doctor or visit the emergency of any hospital if your child is very sick. Usually, if your baby is extremely dull, very lethargic, always sleeping, very difficult to arouse even for feeds, or on contrary, if your child is extremely irritable, crying all the time, and you're not able to console your child by feeding or any other method, or if your child is very cold to touch and the hands and feet appear very blue, or your child is very deeply jaundiced and yellow in color, or if your child is having a lot of vomiting, especially if it is green or yellow in color, not passing stools or continuously passing loose stools, then please do reach out to the nearest emergency, as these are danger signs in a newborn baby. Also, in case your child is having any difficulty in breathing or having a very noisy breathing, please do consult your doctor. Taking care of a baby is a full-time job for any mother or for any parents. And it is this time where support of the extended family makes a huge difference. So, taking care of a baby is not just a parent's job, but please do not hesitate to involve other family members and delegate all other tasks which are not that important. Another thing we are usually concerned about is the sleep of the baby. We always worry whether our baby is getting enough sleep or not. The sleep pattern of the baby keeps on varying during the initial few months, and approximately all newborn babies sleep for 18 to 20 hours a day. This is the common standard of all well-fed and healthy newborn babies. Standalone sleep cycles are very limited, and most of the times they sleep during feeding. So we always wonder whether they're getting sufficient sleep or not. But majority of the times they do it while feeding. So usually it is not a major concern. In case your baby is excessively sleepy, difficult to arouse, difficult to wake up, then it may be a sign of illness and you may need to consult your baby's doctor or pediatrician for the same. So these are some of the few common tips regarding parenting in the newborn. We will share with you many such tips in the future, so please log on to the Facebook live sessions at narayanahealth.org. Thank you.